If there is a place where shared society works perfectly in higher education in the Holy Land, the University of Haifa is definitely it. Dr. Alan Hartman is an Australian-Israeli senior lecturer in information systems at the University of Haifa. Over the past 2 summers in August, he's gone to Ladakh in India. And with several Arab-Israeli students, he's developed an app that helps doctors from the University of Taiwan treat Tibetan refugees in the city of Leh, where the Dalai Lama has a summer house. I spoke with Dr. Hartman, Ahmed Abu El-Haja, one of his students, and Hamdi Basul and Nadia Surhan, 2 students who will participate in the program in 2020, and I asked them how this whole thing came together.
Well, it goes back quite a long way because before I joined academia, I used to work for the IBM Research Lab. And I worked for almost 3 years in the lab in Bangalore in India for IBM. During that time, I got involved with a program for a boarding school in Leh, where my wife and I volunteered to help teach the teachers. We're both mathematicians by training, and we worked to get these students better math education. Then, 3 years ago, I was at the boarding school when the Taiwanese doctors came, and they've been coming every year for the last 4, 5, 6, 7 years. Now, they were working in a kind of primitive way. They were recording stuff on paper, and eventually when they got back to Taiwan they would put it into Excel spreadsheets, and they were losing data. The data was unreliable. So I offered to give them IT support using my students at the University of Haifa. By that stage I'd left IBM, I was at the University of Haifa, and I had the resources to help them. So the first year I had 2 students build a cloud-based database to keep all their records in a permanent place and with access to previous year's data about the students that they were examining each year. And then this year, in 2019, we introduced a mobile app to help them gather data in the field and get it loaded straight up into the cloud in conditions where there is very poor communications. I mean, this is happening in the town of Leh, which is at 3,500 meters above sea level. It's happening where the internet is at best patchy, and as was happened this year, the government of India closed down the internet for 3 or 4 days because of the difficulties in Kashmir. So the whole system has to be reliable under pretty rugged circumstances.
The story behind it, it's with on the borders with Tibet, and many refugees are there, and as you said, as you mentioned, the Dalai Lama was there, so it's nice also to learn about all of these things and combine them with this project.
קיבלנו הצעה מהמרצה, מהחוג כאילו, לעשות את הפרויקט של לדק, והתחלנו לממש, התחלנו לאסוף את הנתונים ולממש את הפרויקט.
First of all, I think this is a really big project, and it's really honoring to be a part of this because I think it's really inspiring and helping people to maintain the acknowledge of how the third world countries live out there with the medical insurances and the healthcare that the people need there. So I really think that I am more or less helping.
So we arrived with a system that had never been tried in the field, and we started off at the Jamyang High School, which is a boarding school for about 350 or 400 students from remote parts of Ladakh, and they go to this boarding school and they're away from their parents all week. And mostly for weekends as well. They go back just in the summer holidays. So on the first day of medical exams, there were 350 students lined up to register, and we had to register them at our application and then send them around to the various measurement stations. The first station they measure the height and the weight, the second station they measure visual acuity, they measure blood pressure, they measure various things along the way until they finally get to the medical physicians and to the dentists. Now, initially we had some glitches with registration and the lineup was building up. So my two students, Ahmed and Muhammad, showed incredible, there's a Hebrew word for it, which is initiative. That's the English translation, but it's more important than that. They got up and they said, look, we're going to make this system work, and they took half an hour off from the lineup. They went and they did some patches to the program, and they got the system for registration up and running smoothly, so that we ended up, out of the 350 students that were examined that day, we managed to record all the data for 240 of them, which is not bad for the first day's experience, I think. After this experience, we finished up the following day at the Tibetan refugee camps, and we gathered more data, and we had another day at the Lingshed area hostel, gathering all the data successfully. We've set clear goals for this year. This year we've determined that we're going to do 100% of the students, 100% of the adult refugees, including all the stations along the way, plus the dental station and the physician station, with 100% success. That's our goal for this year, and I sincerely hope we get there. As for applicability in other places, it's certainly, we're building a system to be resilient in the absence of reliable communication. We're also building it that it will run on any Android-based operating system. If we insist on Android-based infrastructure, we'll be able to do anything, anywhere in the world, irrespective of the reliability of the internet and the availability of good communications. I think we should start at home. There are third world applications out in the deserts of Israel where the Bedouin community also need medical help, and I would like to look at that as a next project.
Thank you so much, Dr. Hartman. It's absolutely heroic work that you're doing. Privileged to talk to you. Thank you.